This video will present the admission criteria portion of the NICE guidelines for the management of bronchiolitis. The aim of this video is to present this single portion of the NICE guidelines in a colorful and hopefully more visually pleasing way. The official version can be found on the National Institute of Health and Care Excellence via the link below. Now keep in mind that the NICE guidelines may differ quite substantially from your own local guidelines, so when learning about the admission criteria for bronchiolitis, be sure to refer to local guidelines and seek guidance where appropriate. When assessing a baby or child in a secondary care setting, admit them to the hospital if they have any of the following: apnea, either observed or reported; persistent oxygen saturation when breathing air of less than 90% for children aged 6 weeks and over, or less than 92% for babies under 6 weeks, or children of any age with underlying health conditions. Now please be aware that your local guidelines may differ regarding oxygen saturation. They may also take into consideration the phase of the illness. Inadequate oral fluid intake, that is, about 50 to 75% of usual volume, taking account of risk factors and using clinical judgment. Or persisting severe respiratory distress, for example, grunting, marked chest recession, or respiratory rate of over 70 breaths per minute. To mention once more, your local guidelines may have other absolute criteria for admission that are not stated here. Also consider admission to the hospital if any of the following are present: risk factors for more severe bronchiolitis, such as chronic lung disease, hemodynamically significant congenital heart disease, age in young infants, such as under 3 months, premature birth, particularly under 32 weeks, neuromuscular disorders, and immunodeficiency. Also consider factors that might affect a carer's ability to look after a child with bronchiolitis, such as social circumstances, the skill and confidence of the carer in looking after a child with bronchiolitis at home, confidence in being able to spot red flag symptoms, and distance to healthcare in case of deterioration.